The knee joint occur in old age people due to, first of all, it is wear and tear during the life. Where there is a wear and tear during the life, there will be degenerative osteoarthritis of the knee. And then in older age group, the vitamin D calcium deficiency also leads to osteoporosis, thus causes a damage to the knee or a fracture to the knee and various other problems. When there is a meniscus in the joint due to wear and tear, the bone ends hit each other because of the lack of menisci or cushion in the knee, damages and it forms the osteophytes in the knee. And there is a disease called osteomalacia, chondromalacia, and then there is a cyst in the knee, and there is a possibility of septic arthritis due to injury or ligament injury or collateral ligament or the ACL ligament injury and meniscal injury. Obviously, these are the old among them. The degenerative osteoarthritis is most common after the age of 45-50, where there is a decreased vitamin D due to not exposure to the sunlight, and there is a deficiency of the calcium in the body and the minerals in the body. Obviously, the production of vitamin D will be less in body due to not exposure to the sun, which produces the cholecalciferol or vitamin D. So the calcium vitamin D deficiency associated with wear and tear in the knee, there is a damage, total damage to the cartilage, that is called menisci either side, both the sides, where leads to the erosion of the hard bones of the tibia and fibula, which develops the deformity is called januvarum, and there is a pain, swelling, unable to walk, stand, whatever it may be. So obviously these degenerative changes to be ruled out with a plain X-ray, seeing the space between the two bones that in the knee. When there is a damage to the cartilage, which shows in the X-ray as there is no gap in the two bones. Obviously, there should be at least 6 to 8 mm of space should be there in both the bones, but because of the damage to the cartilage or erosion of the cartilage leads to a rubbing of one hard bone over the another hard bone, there is no space maintained in the joint. So there is deformity because the weight bearing part is inner side of the bone, inner side of the joint, loads on it, your total body weight falls on the axis of the weight bearing, leads to damage to the inner side of the bone, leads to genu-varus deformity. So obviously these all into the consideration. Thinking of the clinical symptoms and taking X-ray, we could diagnose that how much angle deformity in inner side, that is called genu-varus deformity, is there. So the account of clinical symptoms and the X-ray and other MRI, CT scan, the amount of damage to the joint itself indicates if the stage 1, 2, 3, 4, the stage 1, 2, 3, we can manage with the medication, injections and physiotherapy. In stage 4, where there is the entire joint damage, cannot be managed with the medication or physiotherapy, hence we need to do a surgery, that total replacement of the joint, which can manage the pain, which can recover the deformity, and there won't be any joint pain, and a patient can walk at least 20 years without any problems. So this is the way we manage the older age group knee pain.